You walked into a room and forgot why. A name you have known for years suddenly would not come. You reread the same paragraph twice and still could not hold it. And your first thought was, this is just what happens when you get older. That assumption is understandable. It is also, in many cases, incomplete, because for a meaningful number of people over 60 who are experiencing real, noticeable memory changes, the primary driver is not age itself. It is something correctable, something that has been quietly building in the background while age takes the blame. That distinction matters enormously, because one path leads to resignation and the other leads to action. In this video, we are going to walk through 5 causes of worsening memory that are frequently overlooked, frequently mistaken for aging, and in many cases addressable once they are identified. We will look at what is happening inside the brain when each one is present, how to recognize the pattern, and what a practical next step actually looks like. One of these 5, the fourth one, is something almost every person over 60 is exposed to, and very few people think to connect it to memory. We will get there. Before we begin, one important boundary. If you are experiencing sudden, severe, or rapidly worsening memory changes, particularly if they are accompanied by confusion, difficulty speaking, one-sided weakness, or significant personality changes, those symptoms deserve prompt medical evaluation, not a video. What we are discussing here is the more gradual, accumulating kind of memory difficulty that most people chalk up to normal aging. If there is any doubt about urgency, contact a healthcare provider. The brain does change with age. Processing speed slows somewhat. The speed of recall, how quickly a name or word comes to you, tends to decrease. These are real, documented changes, and they are a normal part of the aging process. But here's the part that gets left out of most conversations. The brain also has a remarkable capacity for compensation. It can reroute. It can build new pathways. It can maintain functional memory well into later decades when the conditions supporting it are reasonably intact. The key phrase is, when the conditions are intact. Memory is not a fixed organ with a shelf life. It is a dynamic process, one that depends on blood flow, sleep, chemical balance, inflammation levels, and a functioning network of systems that talk to each other constantly. When any one of those systems is disrupted, memory suffers. When the disruption is labeled just aging and left unexamined, it continues. Think of it like a sophisticated communication network. The hardware, the neurons, the synapses, is largely intact. But the signals traveling through that network depend on infrastructure, adequate power, clear lines, minimal interference. When the infrastructure degrades, messages get dropped, delayed, or scrambled. That is what many people are experiencing when they say their memory is getting worse. Not hardware failure, infrastructure strain. That is the lens through which this entire list makes sense. Cause 1. Sleep fragmentation and the overnight filing problem. Most people understand that poor sleep affects how they feel the next day. What far fewer people understand is what poor sleep does to memory over time, and why the problem is particularly relevant after 60. During sleep, and specifically during the deeper stages of the sleep cycle, the brain performs a process that researchers sometimes describe as memory consolidation. The experiences, information, and impressions of the day are processed and transferred from short-term holding into longer-term storage. This is not a metaphor. It is a well-documented neurological process, and it requires adequate time in the deeper stages of sleep to complete. Picture it this way. Imagine every day generates a stack of papers that need to be filed properly before the next day begins. Deep sleep is the overnight filing session. When it is interrupted repeatedly, by waking, by light sleep, by the kind of fragmented night that becomes more common with age, the filing does not complete. The next morning, some of yesterday is still in a temporary pile that is vulnerable to being lost. After 60, sleep architecture changes. Deep sleep naturally becomes lighter and shorter. Waking during the night becomes more common. None of this is a disorder. It is a normal shift. But it means that the baseline filing efficiency has decreased, and any additional factor that further disrupts sleep has a larger impact on memory than it would have had decades earlier. What makes this particularly important is that many people with significant sleep fragmentation do not feel severely tired. They have adapted to it. They function. But their brain's overnight maintenance work, including memory filing, is being done incompletely night after night. The pattern that warrants attention. Waking more than 2 or 3 times per night consistently, feeling that sleep is light or unrestful even when the hours are adequate, or waking in the early morning and being unable to return to sleep. Any of these patterns, sustained over weeks or months, can contribute meaningfully to the kind of memory difficulty that feels like aging. If sleep is genuinely disrupted, that conversation belongs with a physician, especially if snoring or breathing pauses are involved, because sleep apnea is a documented and underdiagnosed contributor to cognitive changes in older adults. But the next cause works through a completely different mechanism, and it is one that builds so gradually most people never notice it is there. Cause 2. Thyroid function that has shifted outside the optimal range. The thyroid is a small gland at the base of the throat, and it regulates the metabolic rate of virtually every cell in the body, including brain cells. When thyroid hormone is in the right range, brain chemistry, energy production, and nerve signal speed all operate normally. When thyroid function slows, as it does in a condition called hypothyroidism, those processes slow with it. Cognitive symptoms of underactive thyroid can include difficulty concentrating, slower recall, mental fogginess, and the general sense that thinking requires more effort than it used to. These symptoms are real, and they are caused by a measurable biochemical change, not by aging, and not by a declining brain. The reason this goes unidentified so often is that the other symptoms of hypothyroidism, fatigue, feeling cold, mild weight changes, low mood, are each easy to attribute to other causes, including age. The picture builds slowly. No single symptom is alarming enough on its own to prompt investigation. By the time the pattern is recognizable, it may have been present for years. Think of thyroid hormone like the voltage setting on that communication network. When voltage is correct, signals travel at the right speed. When voltage drops, everything slows down. Not catastrophically, but consistently across every system. Memory difficulties in this context are not a brain problem. They are a fuel supply problem. The straightforward practical step here is a blood test. Thyroid function testing, specifically measuring TSH, or thyroid-stimulating hormone, is a routine, widely available test. If you have been experiencing memory changes along with unexplained fatigue, sensitivity to cold, changes in skin or hair, or low mood, and you have not had thyroid function checked recently, that is a specific and reasonable conversation to have with your doctor. Hypothyroidism is treatable. When it is identified and managed appropriately, cognitive symptoms often improve, sometimes significantly. If you are noticing these patterns in yourself or someone you care for, write that question down now. When was the last thyroid check? That single question may be the most useful thing from this entire section. Cause 3. Medication effects on memory and cognition. This is the cause that generates the most surprise, and it deserves careful, honest attention. A number of medications that are commonly prescribed to adults over 60, and several that are available without a prescription, have documented effects on memory, attention, and cognitive processing. Some of these effects are well known within medicine, but rarely communicated clearly to patients during brief appointments. The category that receives the most research attention is a class of drugs with what is called anticholinergic activity. Acetylcholine is a neurotransmitter, a chemical messenger, that plays a central role in memory and learning. Drugs with anticholinergic properties block some of this activity. The result can include short-term memory difficulties, slowed processing, mental fog, and in some people, more significant confusion. The notable thing about anticholinergic drugs is that they appear in categories that people do not associate with brain effects. Certain older antihistamines, some bladder medications, certain antidepressants, some stomach medications, some sleep aids. Many people take these regularly without any awareness that cognitive side effects are possible. Think of acetylcholine as one of the chemical languages the brain uses to write new memories. Medications that interfere with that language do not stop the brain from functioning, but they can make the writing process harder, slower, and less reliable. The cumulative effect matters here. A single medication with mild anticholinergic activity may produce little noticeable effect. 2 or 3 such medications taken together may produce a meaningful combined burden, what researchers sometimes call anticholinergic load. This is not about any one pill. It is about the total effect of everything in the daily medication list. The practical step is not to stop taking medications on your own. That can be dangerous, and any medication review should involve a physician or pharmacist. The practical step is to bring a complete list, including all over-the-counter medications and supplements, to your next appointment, and to ask specifically, do any of these have effects on memory or cognition, and if so, are there alternatives? That one question, asked clearly, can open a conversation that a busy appointment might not otherwise reach. Pause here for a moment and think about how many items are on your current daily medication list. It is worth knowing. Cause 4. Chronic low-grade inflammation. This is the one most people do not see coming. Inflammation is a word most people associate with visible swelling, a sprained ankle, an infected cut, a swollen joint. That kind of acute, localized inflammation is the body's repair response doing exactly what it should. But there is another form: chronic, low-grade, systemic inflammation. There is no swelling you can see or feel. There is no obvious injury. Instead, the body's inflammatory signaling stays mildly elevated for months or years, often without any obvious acute trigger. And the brain is exquisitely sensitive to this state. In the brain, chronic inflammation is associated with impaired communication between neurons, reduced neuroplasticity, the brain's ability to strengthen and form new connections, and a disruption of the metabolic environment that memory consolidation depends on. When inflammatory signals are persistently elevated, the brain functions differently. Recall becomes slower. Holding new information becomes harder. Mental clarity decreases. What drives chronic inflammation at this level? The contributors are numerous and individually common: poor sleep, excess visceral fat, chronic psychological stress, a diet high in processed foods and refined sugars, physical inactivity, certain chronic conditions, and disrupted gut health, among others. Notice that several of those contributors also appear on lists of risk factors for other conditions, which is why chronic inflammation has become an area of significant ongoing research. The key insight is this: each individual contributor may seem minor. One poor night of sleep, one stressful week, one period of inactivity, these are not crises. But when those contributors are sustained and overlapping, months of disrupted sleep, plus chronic stress, plus limited movement, plus a diet leaning heavily on processed foods, the combined inflammatory burden on the brain can be meaningful. This is why memory problems from inflammation do not usually appear suddenly. They accumulate. And because they accumulate slowly, they are easy to attribute to something else, like aging. The practical step here is not a single test or a single intervention. It is an honest inventory. Which of the known drivers of chronic inflammation are consistently present in your daily life? Not what you plan to change, just what is actually there. Sleep quality, movement patterns, dietary patterns, ongoing stress levels. That inventory is the starting point. If there are specific medical concerns, persistent fatigue, known autoimmune conditions, ongoing pain, those belong in a clinical conversation that can include appropriate testing. Cause 5. Social withdrawal and the reduction of cognitive demand. This final cause is perhaps the most personal one on this list, and it deserves to be treated with care. The brain is not a storage device. It is an active, adaptive organ that responds to the demands placed on it. When those demands are consistently high, when the brain is regularly challenged to follow complex conversations, navigate novel situations, construct and communicate ideas, manage social nuance, it maintains and in some cases strengthens the neural circuits that support memory and executive function. When those demands drop significantly, those circuits get less activation. And circuits that get less activation over time become less efficient. Social withdrawal tends to happen gradually after 60, and almost always for understandable reasons. Retirement removes one of the most consistent sources of daily cognitive engagement. Close friends and family may move away or pass away. Health challenges or mobility changes make leaving home less convenient. The habit of a quieter, more solitary daily life settles in. Each individual step makes sense. The cumulative effect on brain function deserves honest consideration. Here is an illustrative scenario that reflects a common pattern. Imagine someone who spent decades in a demanding career, managing people, making decisions, holding complex information, navigating competing priorities. After retirement, their daily cognitive load drops significantly. They read, they watch television, they manage the household. All valuable, but none requiring the level of multi-system engagement their brain had maintained for years. Within 12 to 18 months, they begin noticing memory lapses they did not have before. They assume it is age. In some cases, the primary driver is not age. It is the sudden removal of the conditions the brain had relied on to stay sharp. The distinction between social withdrawal and necessary rest matters here. Rest is important. Solitude has value. The concern is not about every quiet evening. It is about a sustained, significant reduction in the kinds of engaged, interactive, effortful social and intellectual activity that the brain uses as exercise. The practical step. Identify whether the overall level of genuine cognitive and social engagement in your daily life has decreased significantly in the past 1 to 3 years, and if so, whether there are realistic, accessible ways to restore some of that engagement. It does not require a career. It does not require a large social network. It requires regular situations where the brain is genuinely working, following a complicated discussion, learning something unfamiliar, navigating a real problem, engaging with ideas that push back. You have just walked through 5 causes of memory change that are frequently overlooked, frequently mistaken for aging, and in many cases addressable when identified. The practical next steps are simpler than they might appear. First, take an honest inventory of your sleep quality. Not just how many hours you are getting, but how fragmented, how restless, and how restorative those hours actually are. If there is a persistent pattern of disrupted sleep, bring that observation to a physician, particularly if snoring or breathing pauses are involved. Second, if you have not had thyroid function tested recently, and you are experiencing memory changes alongside fatigue, intolerance to cold, or low mood, request that test by name at your next appointment. It is simple, routine, and potentially very informative. Third, compile your full medication list, prescription and over-the-counter, and bring it to your next appointment with a specific question. Do any of these have documented effects on memory or cognition? This question may not be answered in a rushed visit. You may need to request a dedicated medication review. Fourth, take stock of the lifestyle factors most associated with chronic low-grade inflammation. You do not need to change everything at once, but you do need to see the picture clearly before you can decide what is most worth addressing. Fifth, evaluate honestly whether the level of genuine social and intellectual engagement in your daily life has decreased significantly. If it has, explore one specific, accessible way to restore some of that engagement, something that requires real interaction, real challenge, or real novelty. And finally, bring your observations to a physician. Not a list of fears, but a list of specific patterns. When did this start? What does it look like? What other symptoms accompany it? What changes in my life have coincided with it? That kind of organized, specific account helps a physician ask better questions and order more targeted tests. Memory changes deserve investigation, not resignation. The goal of this conversation was not to make every memory lapse feel alarming. Most forgetting is ordinary. What warranted our attention today was the pattern, the sustained, accumulating difficulty that quietly builds and gets quietly accepted as the price of getting older. Sometimes it is, but often it is something else. Something that has a name, a mechanism, and in many cases, an approach that can help. Your brain does not stop being worth understanding just because you are past 60. The habits, the chemistry, the sleep, the engagement, the medications, the inflammation levels, all of it continues to matter. And you are in a better position to make decisions about all of it now than you were before this conversation. If any of the 5 patterns in this video felt personally relevant, write down the one that felt most relevant. Then bring that observation to your next medical appointment as a specific question, not a vague concern. If this kind of content is useful to you, subscribing means you will see the next video when it comes out. And it is worth knowing what is coming. In the next video, we will look at the specific warning signs that distinguish normal age-related forgetfulness from changes that genuinely warrant prompt professional evaluation, including the one distinction that most people miss entirely. Your memory is not just a symptom of your age. It is a reflection of everything your brain is living inside. Understanding that is the first step toward protecting it.